Lillian, if you could help me identify or can I call on Joseph Samek to answer? Joseph, can you unmute? Y'all can even type it in the chat box. Full-time doctors, I think most of us do encounter this type of a situation. I see Dr. Ashiana is online. Ashiana, would you like to jump in on this one?
Yeah.
Go ahead.
I think the main thing is between doctors and patients, there's a huge level of trust. Obviously, we are the ones that have all of the information. So they come to us expecting that we're going to do what's best for them. And although you might think medicine is good in a certain situation, you have to take into consideration what that patient's concern is. And if you break that trust, it becomes a big problem establishing it again, not just with you, but with any other doctor. And it becomes an issue once the side effects come into play and the patient wasn't aware of them. So as much as you might think, okay, those aren't, like he won't take the medicine if he knows those side effects, I think that's all the more reason to disclose them because they are relevant to the patient and what's going on in the patient's body.
Thanks for
It has to be an informed decision that they make.
Thanks for that, Ashiana. Dr. Irfan, do we seek another response or you want to move on to the next case or discuss this one?
No, I think Dr. Ashiana has explained it really well. It's all about making sure that we don't lose the trust that our patients have in our practice, in our processes. So whatever information is available that should be given to your patients, make sure that it's given to the patient, whether it's good information, bad information, whether you feel it will change their decision about whether they want to continue with the treatment or not. That's actually their right. So thank you, Dr. Ashiana. It's all about making sure that we maintain the trust that our patients have in our processes. So before we go any further, sorry, is someone saying something? All right. So let's understand what patient-centered care is all about. There are some people who call it person-centered care or people-centered care. So what you choose to call it, that's entirely up to you. But let's understand a little bit about why this is so important. So around the world, people are living much longer. And we are seeing people living longer with a lot of different complex diseases, diseases that often take a long time to resolve, that may take much. Unfortunately, through this entire process, not all patients are informed of the decisions that are made or the decisions that are taken around the care that is provided to those patients. And in some countries, we also find that only one in three patients would actually receive an explanation about the risks of their treatment. And this is information that has come from WHO. So what they told us is that in some countries, 1 in 5 patients would actually end up having an unnecessary test simply because of not having a patient-centered care approach in their practice. And as a result of this inefficiency, we would see a wastage of up to 40% of health funding in the countries where this study was conducted. Also understand that when patients come into our center for treatment, whatever condition that they're suffering with, whatever medical condition they have, it's not something that they are battling with only at that point during the consultation. It is something that they're battling with 24/7 for the period of that illness. So as a result of that, we have to make sure that our care processes are tailored for our patients. specifically to suit their needs. Whatever care processes we're implementing have to be collaborative. We should be able to involve the patient, their families, and even other clinical team members. And this is a big shift from what medical treatment used to be in the past, where what the doctor says is what should be done. But in today's time, we're seeing more of an emphasis on a conversation, a communication, a decision making, and a collaborative decision making between the patient, their family, and the caregiver. We also want to emphasize on care that is provided to patients, families, and their communities, which is respected, care that is informed. So you're giving all the information that is required or that is needed to your patient. You're making sure that the patient is engaged in that care process. Their family or friends, where applicable, are involved in that care process. The patient is adequately supported, especially when it comes to things like mental wellness, emotional support, physical support. All of that is available in your care process, making sure that the way you treat your patient is with utmost dignity and compassion. And ultimately, patient-centered care has lasting benefits. What it does is it improves trust, as we had talked about in the previous case. It improves the experience that the patient will have, and then, of course, the outcome of that encounter that that patient had with the medical provider. When you see your patient engaged, when you see your patient having a positive outcome, the other effect is confidence that is increased in our clinical teams, and then, of course, job satisfaction. And ultimately, we see an improvement in our quality and efficiency of our processes. So patient-centered care, or people-centered care, the way you want to call it, can increase accessibility to healthcare, and it can reduce unnecessary use of services. And what this really means is that the patient is the right way, the patient is receiving it at the right time, and we try and implement this 100% of the time. Adhere to in our day-to-day practice is by making sure that we employ a steep mnemonic, and you can see that on the screen in front of you. And what this means is that making sure that whatever treatment you're giving your patient, whatever intervention you're giving your patient, has to be safe for that patient. So care processes that are safe, making sure that whatever intervention you're giving your patient is given in a timely fashion. Depending whatever treatment you give, our resource be treated, and at the end of it, making sure that your patient is at the center of the entire process. And that's what patient-centered care is all about. Now, this has not always been the case in medical practice. We've not always had this approach to clinical care, and it's all about now being able to reshape our thinking on how services are organized, managed, and delivered. And it's all about moving away from asking our patients, what is the matter with you? And more towards asking the patient, what matters to you, right? So taking into consideration what the patient wants, how the patient feels, what the patient feels should be done, who the patient feels they want to involve in their care process. So really taking into consideration, the key issues that the patient feels are important to them. Now, there are about 8 principles of patient-centered care that you need to have at the back of your mind when you're trying to approach patient-centered care. And that is making sure that whatever care process you have for your patient, the way you treat your patients, it's in a respectable manner. Making sure that the treatment you're giving your patient, the thought process behind the treatment you're giving your patient is coordinated. If you need to involve a multidisciplinary team, then you're able to do that. Also making sure that you provide adequate education and information to your patient, making sure that you have physical comfort. So when your patient comes into the clinic, are they in physical comfort when they are receiving care? If you are dealing with a case that is, giving a lot of emotional challenge, is the patient receiving appropriate emotional support? especially when it comes to things like end-of-life care, wellness issues. Are we able to provide emotional support to our patients as well? As we had mentioned previously, being able to involve family and friends in decision-making, that is also one of the principles of patient-centered care. Making sure that also we have a continuity of care. So whether the patient is leaving your center and going to AKU at home, for example, there has to be that continuity of care. And then making sure that access to care is always through telemedicine, whether it's through AKU home, whether it's through making sure that care is available through one of the other avenues, like one of our outreach centers that's closer to the patient. But that's also very important when you're looking at the principles of patient-centered care. So Dr. Aziz, look at the second case.
Case 2. Mr. Jackson, a 65-year-old patient with chronic back pain, arrives at the clinic for his appointment. He's visibly uncomfortable and tells the receptionist, Sarah, that he is in a lot of pain and hopes to be seen quickly. The clinic is running behind schedule, and Sarah knows there will be a long wait. She's busy answering phone calls and checking in other patients, but quickly responds, "You'll have to wait like everyone else. The doctor's running late." Meanwhile, Dr. Lee, the attending physician, sees Mr. Jackson's name on the list and notices his history of severe back pain. When Mr. Jackson finally sees Dr. Lee, she rushes through the appointment due to backlog of patients, not taking time to discuss his pain management options in depth.
All right. So just keeping in mind the slide that we just went through, the 8 principles of patient-centered care. Looking at this slide, I'll request Dr. Azima to pick someone to just give us an answer for the first question.
Josephine? Josephine from Mackay, are you online?
Yes, Dr. Azima.
So it's a multiple choice question. I'm going to read it out to you. What aspect of patient-centered care could Sarah have improved in her interaction with Mr. Jackson? 1, emotional support and empathy. 2, coordination of care. 3, information and education. 4, physical comfort.
I would go for emotional support and empathy and coordination of care.
Dr. Irfan, can I pick someone else for the next question?
Yeah, that's okay.
Okay, Lydia, are you online? Can you help us answer this one? Lydia, can you unmute and confirm if you're online? Lydia from Valley Arcade. Teresa from Karen, are you online? Okay. Okay, so Lydia says she'll answer in the chat box. I'm going to read the question out loud. Second question, how could Dr. Lee have better aligned her approach with patient-centered care? Option 1, by rushing through the appointment to stay on schedule. Option 2, by prescribing pain medication without discussing alternatives. Option C, by taking a few extra minutes to explore Mr. Jackson's pain concerns and involving him in the treatment plan. And 4, by rescheduling the appointment to allow for more time for later. So Lydia has answered option 3 in the chat box.
Excellent.
And we have a
And the
few
last
other responses also for 3. Thank you for that. Thanks for being engaging. Question 3. Teresa, do I have you now? Okay. So I'm going to read it out and then we'll call on someone to take the question. Question 3, how could non-clinical staff like receptionists contribute to a patient-centered care approach? One, by sticking strictly to their administrative duties and ignoring patient concerns. Two, by showing empathy and offering updates on wait times to reduce patient anxiety. Three, by limiting communication with the patient to avoid delaying the schedule. Or four, by referring every patient question directly to the doctor. And I think we've got a bunch of responses on two already here, Dr. Irfan.
Excellent. That's okay. So thank you all for giving your responses. I can see that at least the understanding is there based on the 8 principles of patient-centered care. So when we are trying to approach patient-centered care, it's important to understand also the facets that play a part in a holistic approach. And first and foremost, we have our patient and family education. So whatever it is that your patient has come for, once you have come up with a diagnosis, make sure that the patient understands what the diagnosis is. Whatever your thought process is around the treatment that you want to give that patient, make sure that there is education that is given to the patient. And for those centers that have been through Safe Care Phase 1 and those that are going for Safe Care Phase 2 in the next couple of months, you will find that there will be so much emphasis on patient and family education during the audit. So this is a very, very important aspect of patient-centered care. And it starts right from when the patient comes in. Do you have your patient and family rights and responsibilities charter? And we'll look in detail on what some of the rights and responsibilities are that are captured in this charter. So just having it available, and we had talked about it with the Safe Care clinics, making sure that you have the flyers available in triage, starting your patient education on rights and responsibilities right from the triage, emphasizing some of the rights and responsibilities, like refusal of treatment, the right to get a second opinion also, when the patient goes in to see the doctor, for example. If you are having any procedures that require informed consent, then that also in itself is part of your education. So make sure that you have you've discussed with your patient what procedure it is that you're doing, who's going to be doing that procedure, what are the risks, the benefits, the alternatives, including not doing the procedure at all, or not doing the treatment at all, and what the outcome would be of that. Do we have a complaint handling process in the center? Are patients aware of that? Do they feel empowered enough to be able to actually give us feedback at the end of their visit? If you have any patients who are going through end-of-life care and require change of goals, are you able to accommodate that request? Are you able to initiate that conversation, for example? And are you able to take into consideration the emotions and the preferences that the patient or the family will have around their end-of-life care? And at the end of the process, we also want to see this improving our patient experience. And you'll see that at the end of the slide when we have a little bit on patient experience as well. So I've just pulled out some of our patients' rights, and you can see here, for those of you who have seen the charter in the centers, we've got about 13 rights and responsibilities that have been outlined, and this is directly borrowed from what Ministry of Health has prescribed. And you can see here that whatever you are providing your patients as their rights includes things like who is providing care to that patient. So who is the physician? Does the patient know who provided care to them during their visit to that center? Do we have information on medical care and treatment that's being given to the patient? Does the patient know that they can seek a second opinion if they want to? That's one of the rights as well. Does the patient know that they can refuse treatment or the plan of care that you have provided to them? Confidentiality, privacy and confidentiality is another big one. So does the patient feel like we took into account their privacy and confidentiality? It's a question that we also ask in our survey, when patients are leaving our centers. And again, it's a big one when we have the assessment going on, the Safe Care audit, when it's happening. The auditors pay close attention also to whether you're closing the door when you're seeing your patient in triage, in the consultation room. Can the conversation be heard on the outside? How are we handling patients who are in pharmacy, who are receiving medications, and we're dispensing that medication? How are we providing education to those patients while also maintaining privacy and confidentiality? Does the patient have access to their health information? So whether it's through an app or whether it's through requesting the PSC to print out their reports, do we have access to providing, does the patient have access to their health information when they want to? I had mentioned in the previous slide, do we have a complaint handling process? So do the patients feel like they can voice their grievances? It's one of their rights to be able to give us that feedback as well. And then where we have clinical research going on, being able to give patients that information on clinical research as well. On the flip side, patients also have their responsibilities, and you can also take them through this when they come into the center. One of them is them being able to give us correct and accurate information about their health condition, being able to complete their personal particular information when they're being registered at the center accurately, being able to ask questions if they need any clarification. As much as patients have the right to refuse the treatment plan that you've given, but once they agree to it, it's their responsibility also to adhere to that treatment plan that you have prescribed. And if they have any questions or concerns, then again, it's their responsibility to bring that up for you to be able to air that out. We also have hospital rules and regulations, and patients have the responsibility of abiding by the rules and regulations that we have in our institutions, and also making sure that patients interact with each other in the center and with our staff in a respectful manner. So I've just picked out a few, but you can take time to go through the patient's rights and responsibilities charter that's available at the center, and also make sure that your patients are aware of this document or this charter being at center level as well. So when it comes to patient and family, sorry, just a minute. When it comes to patient and family education, it starts off from, first of all, are we able to assess the patient's education needs? Are there any barriers to education? Are there any challenges, with cognitive barriers? Are there any barriers, for example, are you dealing with mental health patient? Are you dealing with an elderly senile patient? Are you dealing with a minor who may not be able to receive education independently? Is there an ability and willingness to learn? So taking again into consideration emotional, physical, and cognitive barriers to learning. And then whatever the patient's values and preferences are, we must be taking that into consideration also when we are providing education to our patients and their families. You can involve the family members in the education process. That's very, very important. And one key point that came out during our last Safe Care survey is that we have big gaps in our documentation when it comes to patient and family education. So it's not enough just to be able to tell patients or verbalize the education to them. They should be able to receive printed material, whether it's in the form of flyers, whether it's in the form of something that can be printed out from MT, but they should have something also that they can go away with in print form. When it comes also to the documentation on MT, this was also a gap. And remember that what is not documented is considered not done. So let's also pay very close attention to how we document our education content. When we are educating our patients, there are several things to take into consideration. One is the patient's disease process and treatment plan. So make sure that when you are documenting it and when you are explaining to the patient their education, at the end of the visit, make sure that you've told them what their disease process is and how you plan to treat it. Make sure you've also documented and talked about any medication or medication that may be required in their care process. If there is any procedures or tests that need to be carried out, make sure that you have documented that and also told the patient that we need ABCD tests to be conducted to be able to come up with a diagnosis or to be able to carry on with the treatment process. Make sure also that when you have received the results of those tests that you have requested for, that you have actually documented that in the patient's record, and there is a good communication between you requesting the results and you reviewing, you requesting the test and you reviewing the results of those tests. If you are recommending any nutrition or diet changes, then make sure that is also documented and provided to the patient. If there is pain management that you are educating the patient on, that's also one of the things that you can pay close attention to. And any actual anticipated or potential costs is also the patient's right to know, and it should come in part of your education as well. So I know that when the SafeCare auditors had come down, they were asking us, how do patients get access to information around the cost of their treatment? And while we do not have it displayed on some kind of a charter in the center, the patients should be able to receive that information from the PSC or anybody else involved in their care process who may want to be able to clarify what a treatment or care process is going to cost for that patient. When you're giving an informed consent or when you're getting an informed consent signed from your patient, remember that informed consents are signed in situations where you are doing an invasive procedure, diagnostic or therapeutic procedures, where there may be sedation also being done. Make sure also that this informed consent is documented in the patient's medical record. So while we are on EHR, we are supposed to also make sure that this informed consent is scanned and uploaded on MT. And this was something that was also observed during the audit process. They also want to look at how quickly we're able to update our medical records from physical to online as well. And making sure that the physician provides all relevant information to the patient during the process of signing that consent form. So whatever the risks, benefits, and alternatives of that procedure or treatment are, make sure that that is documented and verbalized to that patient as well, and in a language that patient can understand. So if that patient has any language barriers and that will limit the information that you're providing, then make sure that you're able to get somebody from the interpreters list or somebody who can explain it to the patient in a language that they understand and countersign the same as well. So just a few points on what should go into a consent form or what should be captured. Patient's condition must be captured on the informed consent form, and they should understand what their condition is, who is the person who is going to be providing care to that patient or doing that procedure. And we've seen in not in our facilities, but I've seen in other facilities around the country where a consent form is signed by a doctor who is not the one who is doing the procedure. So make sure that the patient understands who is signing and who is doing the procedure as well. What is the likelihood of success from that procedure that you're doing? Are there any concerns that you have when it comes to recovery after that procedure? What are the potential benefits and drawbacks from the procedure that you'll be doing? And of course, we've already mentioned what the alternatives would be, as well as what would be the result of not treating or not doing the particular procedure. That should come out very, very clearly, so that the patient is also aware that you have explored all the potential options, and you have given them those options, and they are aware, and they've made an informed decision before signing that consent form. There are exemptions to obtaining a consent form, and this is for patients. Of course, the legal age is 18 years. But any patient who is unconscious, who is confused, who may be mentally incompetent, then we may be able to get consent forms or informed consent signed by the next of kin. If there is a patient who comes in a life-threatening situation, there is no time to actually go through the informed consent process, then there may be an exemption here to getting that informed consent. You will proceed with treatment and then do all the formalities after that. For minors, of course, below the age of 18, make sure that the consent form is signed by a parent or legal guardian. And at the end of it, we want to make sure that our entire approach to patient-centered care results in improved patient experience. And this is looking at both our clinical and our non-clinical aspects. So making sure that our patient experience is captured from the patient education point, from the care that's being provided by the physicians and the nurses, the support that's available from catering, finance, housekeeping, and we want to see basically a multidisciplinary approach to patient-centered care, so that ultimately results in an improved patient experience. So the patient knows that when they come into that facility, from the doctors to the nurses to the catering team, the finance team who told them about how much it's going to cost them, the housekeeping team who made sure that that facility is, prepared for that patient. If there was an incident where the housekeeper had to support that patient, that the patient actually feels that they were put as top priority during that entire process or during that journey in that facility. So that's all that we could capture today on patient-centered care. If there are any questions, then we can take them at this point.
Please,
Dr. Azima, over to you.
yeah, please feel free to unmute, or you can type your questions in the chat box. Any comments or questions on the session today?
I think this was very well done, Dr. Azima and Dr. Samji, and more so the involvement of the team with the scenarios. This was very well done, extremely well done. Thank you.
We have a question in the chat box. It's okay, I'm going to read it out. Question 1. In the event that we have a patient with language barriers, who should we contact? I am aware that at the main hospital we do have translators, but what about outreach? And then there's also a concern listed. Our patients are complaining that the request and consent form